Hi everyone, welcome back. We hope that was an engaging and fruitful discussion, and now we're going to move into the full group report back. So kind of get a little bit of information about what you all talked about today in your breakout groups. So I'll go ahead and start sharing my screen. So it'll be a Jamboard that we can all, well, it'll be one of our team people here, Maya, who will add all the comments that you give right now for that report back. So let me share my screen really quick. All right, you should be viewing my Jamboard. And so I will go ahead and just start off with room number 1 to see if you had any volunteers to give a report back. So maybe like some highlights from the different topics that you all discussed. So Jose, I don't know if there's a volunteer.
Thank you, Karina. I will ask the same question to see if anybody would like to share their highlights from our group.
I talked a lot, so I'll say some highlights. I would say one of my highlights, and I'm sorry I don't remember your name, but she made a good point of saying when it comes to like engaging with people, outreach and being clear with translations specifically into making sure they're understood by the person with that language. I totally agree. I think we get wrapped up in being accessible, but not paying attention if that thing is actually accessible. We talked about in I'm like, where's our little thingy? Let me pull up the little thingy. With engagement, making sure people are accountable with what is important when it comes to engagement processes that didn't go well. We also talk about marketing and TikTok and being more into people's brains. And with follow through, we talked about acknowledging the community and the organizations that you give you feedback and giving them praise in any way, and creating relationships with organizations that have direct access to the community.
Thank you, Chevy. That was wonderful. Thank you for sharing those highlights. Anyone else would like to provide some highlights? I'll just add one because I think Chevy captured most of the things that we discussed, but I just find this one like super important. Going back to the very basics when we talk about outreach, I think we have shifted to like emails and social media, but there was some comments about making phone calls. I think going back to the very simple thing of making phone calls, establishing that very basic relationship, maybe having a very brief one-on-one to get to know that person on the other end of the line. So just wanted to add that as a something, kind of going back to the basics of things that we can do to improve our reach and build community. And I think that sums some of the topics we discussed, Karina. So I'll hand it back to you.
All right, thank you so much for sharing that. So I'll go ahead and move us into room number 2. So Jonathan and Lisa, I think you'll be doing the report back for that.
Yes, thanks, Karina. I think we had great discussion in our group. We had a member from the community and then several folks from the districts as well. So we got some well-rounded answers. Just some highlights on our end. I think in terms of outreach, the personalized emails to CBOs and other folks, are really helpful, and that's some way that a lot of folks heard about this meeting. And so, making sure that our outreach is, personalized and it's not all general, like on our listservs. Also, just to make sure to highlight the information, from a regional context. And so, how does this impact this specific region or this community versus, just an overall message that we're blasting out on our listservs. We also had a great comment about having some sort of community hub on our website where it's, shows really where to access information on the CARB website, since there's a lot of information there. And, even for, people that are more familiar with the website, it's hard to navigate sometimes. I thought a great comment too about getting the word out about what we're doing is interfacing with hospitals and other medical centers, since these impacts are directly affecting the health of a lot of people around the state. And so to get the word out to folks that maybe aren't familiar with CARB, we can work with healthcare agencies and hospitals in that way.
Then I know what Jonathan looks like you're looking through it, but I was just going to say I also like the idea of someone had about having a outreach toolkit available on the website. So I don't know how that would be implemented, but just someplace people could go if they wanted to help us spread the word about CARB's activities and what we're doing, like some central place to get a toolkit for outreach. And then I think just to remember, we always have to build on what we've heard already. So instead of just feeling like we go to communities as if we're starting from scratch, like how do we work together to kind of continue to show communities that we've heard them and they don't have to repeat themselves. That's a challenge, but I think that's important to remember, that we have to kind of build on what we've heard from them.
Yeah, absolutely. Building that and just making sure that, we're talking internally as well to make sure that we, in the agency, have that historical context about how we have communicated with CBOs and other folks. I think that covers.
There's the one about sending an
ahead.
email congratulating people when their feedback was incorporated. I don't know how that would be implemented, but it seemed like it's always good to be positive and say, hey, we you've helped us with this form this regulation, or you've helped, your input was taken this way or that way, and just kind of congratulations. So that was kind of a new idea.
Yeah, and to go off that, also status updates about, just letting them know, yes, we have received your feedback, what the feedback was, and then, a couple updates along the way until, whether or not it got incorporated into the CARB action. If there's anyone else from our group that wants to add anything that Lisa and I might have missed, please feel free.
I think you got all the big highlights. Thanks.
Yeah, thank you.
All right, thank you, room number 2. I'll go ahead and invite room number 3, Deidre, to see if there's anyone from your group who would like to share.
I'll kick this off, but folks from that group should feel free to jump in. We had a lot of really great conversations that echo a lot of what you all were hearing in the other 2 rooms. I think, picking up sort of where Lisa and Jonathan's room left off in regards to follow through, we heard very similar things, but also, information, kind of continuous follow through. So not just, what happened in a meeting, what did we hear, and what are we going to do about it? But then how does that information make its way to decision makers? So much larger kind of policy impacts, and what are they doing with that information, and how is it being acted upon? And there was also, making sure that we're doing follow through even when there's not a specific comment or action. So someone brought up, given the kind of current budget situation, how are we communicating with different groups to let them know what impacts there might be on different programs, and how we're continuing to do our work in a challenging budget environment. So keeping those kind of lines of communication open. We also got a lot of really great examples of ways to do good follow through, ways to do good communication. There was a really great example coming from a methane task force around leaking wells, and ways that folks were partnering with trusted community groups, AB 617, folks to co-develop information and to share that out, and to continue to have good communication there, including, doing door-to-door outreach. So thinking outside of the listserv environment. And we also had examples of where community engagement hasn't gone well, and where people feel that they're sort of trying to figure out where jurisdiction their problem is under, and to get someone to listen to them, and having to escalate and being concerned about health impacts. So continuing to think about, well, what are the ways we can simplify that for communities to make sure that they're getting their concerns listened to and answered, even if it's outside of our jurisdiction, so people don't have to have a PhD in understanding which jurisdiction they're under for their very legitimate concern. So I think those are the big highlights coming out of our group, but if there's anyone else from our room that wants to jump in and add anything or correct something I may have got wrong, please feel free.
I think from our group, one of the top takeaways I got was that a lot of people care very deeply, and they feel like their amount of effort may not be matched by the state's amount of effort, that there is a disconnect between the community's concerns and cares and what CARB is doing.
All right, thank you so much, room number 3, for also providing some great ideas on outreach, engagement, and follow through. We have a pretty full board here, and it's interesting to see just the wide array of different conversations that were happening. You know, I see more differences than similarities, but they all really, hone in on like key topics, right? So in terms of accessibility, it's ensuring that when you are providing accessible ways to get to information, that they truly are. So making sure that the quality is there, right? And then also, in terms of outreach, there's different ways to do outreach. So we have, focusing on social media, TikTok, or even going to less traditional ways that us, at least as an agency here at CARB, maybe we don't do as much, like door-to-door outreach. Maybe that's something that, if we really want to get information out on a certain program, that's something we should look into. But, being cognizant that we do have budget constraints, but if it's a possibility, it definitely should be something that is looked into to see if it's possible. And looking here at some other comments that you all shared, just really having that personal connection with people. So building those relationships. So ensuring that, if an individual provides feedback, that it doesn't end there. There should be, it's a two-way street, They took the time to provide feedback. You should take the time, us at CARB as staff people, to thank you for that and let you know what happens with that information. Or at least pointing you in the right direction where you can find updates if there are going to be any on what you shared. Looking back here at the Jamboard, kind of goes back to outreach. So ensuring that, wherever we post information, maybe be a little bit more creative. So hospitals, medical facilities, that's maybe somewhere that we don't typically post information. But maybe it should be, depending on, what our CARB action is about. Looking over here again. Yeah, I think, there's just a lot of topics here. So I will encourage everyone to maybe take a look. The link to this Jamboard will remain live. We'll just turn off the capability to add comments so we don't accidentally lose any. But you will be able to still use the link in case you want to take a look at this. And of course, all the meeting notes that we have taken, as well as these, will be on our website. But with that, I'll go ahead and stop sharing this screen. Thank you all so much again for sharing your thoughts on this. Really unique ideas today. Okay, so we will transition back to the PowerPoint. So I will go ahead and bring it up in English, and the Spanish one will come up very shortly. All right, you should be seeing my blue slides. And let me just move a couple things here. All right, so thanks everyone again for such a great meeting today. Before we go, we do have a few next steps. First, we want to share a few ways you can provide additional feedback. Maybe, you couldn't voice some of your comments today. Maybe there wasn't enough time, or maybe you think of some later today. We have different ways that you can submit those. We have an online form where you can submit written comments, which is on our website. Second, you can also just send us an email, which is communityengagement@arb.ca.gov. Third, you can leave a voicemail at 279-216-0967. And fourth, you can also attend another one of our public dialogue sessions, and those are listed on our website. Just a little disclaimer, they will cover probably the same exact questions, but if you enjoyed it today, you're totally invited to join another one of our sessions. Next slide. More broadly, we will keep hosting these public dialogue sessions through the end of January. Then we will use this feedback to revise the model. Then we will meet with our community experts in the spring to share the revised model and get additional feedback from them. And we hope to launch the model in the summer of 2024. In the launch, we will provide summary of the comments, including the ones from this meeting and how they were addressed. And then we will also start working on that training for CARP staff. Next slide. So two last things. This is our last slide. First, we have an online survey that we ask you to fill out, just so that we understand how you felt during this meeting, to see if we can improve our future meetings, since we do have a few still to come. And second, we're happy to stay up to an additional 30 minutes here in case you have other questions or maybe comments or really anything on the model. We will be here for up to that amount of time. But with that, thank you all so much for being here. We really appreciate you taking your lunchtime and then some to talk about community engagement with us. And so with that, that is it for today. Thank you so much for joining us, everyone.
Thank you.